And I have no discourse. The vesical adaptation response to diuresis VLD is a normal subject that when urine output rate increase, voided volume at each voiding also increase, like this. We demonstrated that VLD in the patient was maintained without LUTs and LAC with LUTs. Therefore, VLD is important to maintain a lower urinary tract function, and lack of VLD might contribute to LUTs. The aim of this study was to determine whether patient characteristics affect VLD in male LUTs patients. So we included male LUTs patients who attended our hospital between 2013 and 2018 in this study. Exclusion criteria were diabetes mellitus, neurological disorder, history of pelvic surgery, neoplasm, and urinary stone. We defined VLD as the presence of correlation between urine output rate and voided volume. Using 3 days of 24-hour frequency volume chart, FVCs. Age, BMI, FVCs, IPSS or ABSS, ultrasonography to measure prostate volume, uroflowmetry, and residual urine measurement were evaluated. Patient backgrounds. A total of 47 men entered this study. The median age was 77 years old, and the median prostate volume was 32.2 milliliters. About half of the patients had overactive bladder. Result: correlation between vesical adaptation response to diuresis and patient characteristics. BMI and prostate volume were significantly larger in the absence of VLD group. And a significant relationship existed between the absence of VLD and the OAB. Male LUTs patients without VLD demonstrated OAB, high BMI, and large prostate. Obesity is associated with a chronic bladder inflammation, and non-bacterial prostatic inflammation is associated with bladder overactivity. Previously, we have reported that VLD has acquired after robot-assisted radical prostatectomy in patients with LUTs, following the improvement of LUTs and lower urinary tract dysfunction. Conclusion: BPE and obesity affect VLD in male patients. Inflammation induced by BPE and obesity may contribute to lack of VLD. The lack of VLD might be one cause of OAB in men with BPE and obesity. Thank you.
Are there any questions? My question is, do you think it's specific for men or is it for women the same?
Oh, thank you. And in this study,
it's only men.
Only
right?
men. Yes, yes.
But do you think it's for women the same?
Yes, I think so. Previously reported and healthy men and women have VLD, vesical adaptation response, but it is easy to study, and because I worked at male LUTs patient clinic, so women have VLD, of course.
And have you performed urodynamics in these patients? Have you done?
No, yet.
Maybe you should do to define if there's bladder disease, underlying symptoms. Yeah.
Yeah. I think so. Urodynamic study. We should do urodynamic study. Yes, I think so. But in this study, we didn't.
Right.
Sorry.
So, no other questions? Then, on behalf of my co-moderator, we would like to thank you very much. It's the last day of the Congress. I think it's one of the last sessions already. And we are wishing you a great time, safe travel home, and see you next year in Las Vegas. Thank you very much.